Hello, I am Steve DeRoos, and I am the Program Director for the Spectrum Health Michigan State University Child Neurology Residency at Helen DeVos Children's Hospital. This is a 5-year categorical training program located in downtown Grand Rapids, Michigan, and we accept up to 2 residents per year. Our goal is to train residents to be well prepared for both clinical and academic careers. This is done by seeing a large volume and complexity of patients, involvement in didactics with a resident as both the learner and the teacher, and the opportunity for basic science or clinical research. Education and resident development is our main goal when planning the resident curriculum. Our neurologists love to teach, and we've always received positive reviews from rotating residents, whether they're from adult neurology, pediatrics, or med-peds programs. One of our greatest strengths is in the diversity of our backgrounds. Our faculty represents several different subspecialties from many different children's hospitals in the country. We have expertise and dedicated programs in epilepsy, including epilepsy surgery and advanced neuroimaging, cerebral palsy and spasticity management, movement disorders, neuromuscular disorders, stroke and neurocritical care, headache, autoimmune neurologic disorders, neurogenetics, neurocutaneous disorders, and neurometabolic diseases. The residents have direct access to this expertise, which will be crucial if applying to a fellowship program. I fully expect the residents to be qualified in interpreting EEG, reading neuroimaging, and performing lumbar punctures. There's also an expectation to be involved with nerve conduction velocities, EMGs, vagal nerve stimulator programming, ketogenic diet management, injections for spasticity management, and deep brain stimulators. We have many multidisciplinary clinics, and several of those have ongoing clinical research. We look forward to meeting you and exploring your interests together. Thank you.
Hello, my name is Seth DeVries, and I am the Associate Program Director of the Child Neurology Residency Program at Helen DeVos Children's Hospital. Now, this is a 5-year program involving 2 years of pediatrics, 12 months of adult neurology, and 24 months of child neurology. The first 2 years are spent training alongside the pediatric residency program, and our residents then join the Pediatric Neurosciences Department at Helen DeVos Children's Hospital. Now, those 12 months of adult neurology training are divided between the 3rd, 4th, and 5th years of training. Your education is our priority, and this is done through a multitude of learning opportunities, including didactic lessons, bedside teaching, independent learning, hands-on training, and exposure to a broad range of patient pathology. Our residents work alongside fellowship-trained experts in multiple neurological subspecialties, including pediatric epilepsy, movement disorders, neuroimmunology, neuromuscular disorders, stroke, neurodevelopmental disabilities, and neurogenetics. And the faculty is committed to providing you with a rich experience of training, education, and research opportunities. As a child neurology resident, you will have the opportunity to be involved with teaching medical students and residents from multiple regional medical schools and residency programs. This provides rich interactions and leadership opportunities for you to grow and develop your skills.
Hi, I'm Chantal Bond. I'm one of the adult PGY4 neurology residents here in Grand Rapids, and I was fortunate enough to spend about 4 months of my residency training with the pediatric neurologists here. It was truly a highlight of my residency and an incomparable experience. The depth of diversity of patients that you get to see here really provides an incredible opportunity for learning. And I really enjoyed getting to learn from such a wide array and diversity of patients, especially learning from different specialists who are trained in different areas, including stroke, neuromuscular, epilepsy, and movement disorder. You'll get to spend some time with the adult neurology side as well, and you'll certainly benefit from getting to see a really wide array of pathology and disease processes on the adult side. Luckily, we have our adult hospital, which is Spectrum Health Butterworth, that's just attached to Helen DeVos here. We do have the only comprehensive stroke center in West Michigan, so you'll get to see a lot of patients there on the busy service. We also have a really large adult EMU center as well as surgical epilepsy center. And you'll get to see patients in a lot of other areas, including movement disorder, neuromuscular, neuroimmunology, and patients in the headache medicine side.
Hi, I'm Dr. David Moon, Section Chief of Pediatric Movement Disorders, and I'm so excited for the chance to meet you. When I arrived at Spectrum Health Helen DeVos Children's Hospital, I was truly impressed with the wide variety of expertise and training backgrounds from many elite institutions in our division. We work collaboratively and we rely on each other's unique strengths and subspecialty interests to provide excellent care for our patients and their families. We routinely consult each other on the care of our complex patients. Part of what I do is run a multidisciplinary cerebral palsy clinic, movement disorder clinic, and surgical deep brain stimulation program. We are all committed to your development and needs, not just as a neurologist and pediatrician, but also a person with goals and passions outside of medicine. If you decide to train with us, I can promise you, you will be involved with the care of the complicated and rare, as well as the bread and butter. You will work hard, and you will have fun. You will leave us feeling confident you can thrive in any environment, either as a frontline pediatric neurologist, fellowship candidate, or academic physician. We are dedicated and vested in your growth as a pediatric neurologist and as a whole person, while you spend your time with us and many years after. Feel free to contact us. We'd love to hear from you. Thank you for considering Spectrum Health.